My role at the Commission is I'm Senior Portfolio Manager, and one of the areas that I oversee is the National Medication Safety Program. And so the focus on high-risk medicines is a key part of our national program.
The opioid collaborative will differ from the CLAB collaborative that I was involved in. The CLAB collaborative was very specific in its intervention, and it was applied in the intensive care units only throughout New Zealand. The opioid collaborative, I think, is more at the forefront of reducing harm in that area, in trying to establish what would be best practice in intervention to reduce harm from opioids.
One of the core outcomes, obviously, of why we're doing it is to reduce harm and improve the safe use of opioids. And I think it would be amazing if New Zealand could come up with a set of best practice interventions for the safe use of opioids in an acute hospital setting, and for that to be written up and shared both nationally and internationally.
The reason why a collaborative stands apart from a normal program of change, and is the reason I would encourage DHBs to engage with the program from the start, is that people begin solving problems very early on, especially those that are engaged strongly. And the collaborative makes these solutions available almost immediately so that they can be shared within the group. This allows a vicarious learning, and I think is one of the most important reasons for being involved from the very start of the collaborative.
For those DHBs who participate in the collaborative, the Commission will provide some national guidance and leadership. We will have access to a clinical leader, the ability for the DHBs to access specialist advice. We have a project manager, and we will have some quality improvement advisory services as well, in addition to an expert faculty that will be available to guide and assist participants.
I think that it's important for New Zealand's DHBs to become involved in the opioid collaborative. I think that it's been on the harm agenda for many years, and I think the side effects and the harm done from opioids are far-reaching. They go beyond the immediate effects of delirium, oversedation, problems with breathing, itching, constipation, and I think they impinge on the rate at which people recover in hospital and the length of time they spend in hospital. I think this affects every DHB, and not just specific departments. The benefits to the individual of being involved in a collaborative, again, I think are twofold. There's the learning around achieving the target, there's the learning around the improvement science, but more importantly, I think collaboratives empower people to solve issues and overcome problems in their own context. And I think it leads to a greater engagement between the individual and the organisation.
One of the biggest things that the DHBs and the staff will get out of the collaborative is an improvement in the whole quality improvement science, and really build capability for their multidisciplinary teams. And also there's an ability to network and share and learn with other DHBs in their region, and from the guidance that's given to them by the national experts. As a nurse or staff member, one of the key things that you will learn and receive is actually improved capability, and really getting you to share your local experiences with others in the region, so that you know you're not dealing with issues or problems or challenges alone.
I think there's two key factors for the success of a collaborative. One is having strong leadership, whether it's informal or formal. And I think that is driven by the level of engagement and enthusiasm for the project. Secondly, I think it's imperative that you have the support of the executive or senior structure, because the informal leader needs support that is often not prescribed by their position.
I'd be encouraging DHBs to participate and take part in the collaborative, because it's quite groundbreaking work. It's quite exciting. They'll have an ability to share and look at what is going on locally in their district health boards, and really improve best practice around the safe use of opioids and reducing harm.